He loved his oncologist, and she was one of those people that's available on the phone at night sometimes, and he would take advantage of that, poor thing. But she always let him know that she believed in miracles, which is what he held on to, And even though I think she knew deep down inside that his life was limited, she knew that he could buy him enough time to just do what he had to do. My uncle died at a hospital away from his doctors. He collapsed in the middle of the night. Sorry. And he had to be rushed to a local hospital where they didn't know his history, nor did they really care to know. When I got to the hospital, he was intubated. And laying in the bed by himself. And I could see in his eyes that he was afraid. And we told him, we know what you need, we know what you want. We're going to get you through this. He lived about 4 more days on a breathing machine. And he died surrounded by his family after his doctor sent in his records to the new hospital because he was too sick to be transferred to Loyola. His doctor spoke Spanish. She was not Latina, but she knew how important it was for him to die a comfortable death. And so we got in touch with her. His records were released, and he was made a comfort care, which means that you die comfortably with, you get to lose all the tubes, you get to lose all the painful medications and no more painful procedures. And again, it was something that we didn't understand then, but she helped us to get through. Again, she wasn't Latina, and she wasn't, she spoke some Spanish, but she made herself understood by us. She earned our trust. And I would say that's probably one of the most important parts of the journey that I have taken. Every single person that you meet is finding some kind of battle. You just have to go that extra mile and remind yourself of that. Be extra kind to them. It's actually a quote that is up in my hospital where I practice now. It's in the hallway, and every time you walk by it and you're having a hard day, you remember that. And every time I see that quote, I think of my uncle, because his experiences at Loyola, every time they came in, they rounded on him. They took the time to talk to us, even if it was just about his poop. And it made us know that they cared, Speaking of Loyola and other amazing stories, some of the most amazing times that I had were my international service trips. I'm sure you have heard through the bioethics group that the campus ministry is involved in manning trips to go out to, they used to be mainly Latin American countries, developing world, Haiti, Honduras. I got to go to Guatemala and Bolivia. And I have 2 quick stories because I know we're running out of time here. But when I first went to Bolivia, my 4th year of medical school, I learned that next part of my life, that I'm not from here, but I'm also not from there, kind of smacked me in the face. And while I was so excited to be Mexican-American, going out to help in a Latin American country. After all, my mom, she grew up in Mexico. She was a part of a migrant farm worker family, and they were treated by American humanitarian groups, and they saw doctors on their plantation that had come from the United States and helped them. And so now I was going to get the same chance, and I did that through an ISI trip in Guatemala, which was an amazing experience. I was there, I think, 3 weeks was what we used to do. And then my 4th year of medical school, I was in Bolivia. And there, one of our Loyola doctors set up a clinic there, free clinic for all the patients that can get themselves there. And there were buses that would drive in overnight, 12 hours. And then there was a 3-mile stretch of a road that in the rainy season kind of became a little bit of a river. And I remember the first time that we pulled up to the clinic and I saw this parade of patients walking in through the mud, and they got there and they shook off their feet, and then they just sat there patiently waiting for us to get through the 80 patients a day that we had. I was very excited, and I started to notice that the line going into my room was a lot shorter than everybody else's, and I couldn't figure out what was going on. Well, they thought I was Bolivian or Peruvian, that I was one of their doctors. They wanted the American doctors. I wasn't good enough for them. But then they heard my Spanish and they realized that it wasn't quite as good as theirs. And they were like, okay, she's American too. We'll give her the benefit of the doubt. And I just was so confused. I was like, here I am. I can speak your language. I understand your culture. Why are you running away from me? And it took me a couple of years to sort that one out. But eventually there, we were able to tell them that I was American and that I could help just as much as the other American-looking doctors. And I remember part of the efforts there was cancer screening for women. We did one day with one of our mentors, 40 pap smears between the two of us. Only the women were allowed to do the pap smears. We saw women who had 6, 7 children, had never had a pap smear in their life, and we were walking them through their first one. So that was a pretty empowering moment, and even though they didn't trust me at first, we did eventually earn their trust. It was a strange lesson that I learned, but I did a trip to Peru in my residency, and you guys know residency is, I don't know, for those of you that aren't very medical or don't care too much about the medical field, you start off in residency as an intern where you can work anywhere from 65 to 80 hours a week. You pull 30-hour shifts, and sometimes you get a day off here and there, and you're pretty tired most of the time, but you try to find time to study and learn about your patients so that you don't falter and kill them and end up losing some of that trust that you so valuably tried to build. And after, getting paged after all hours of the day, and you get interrupted when you're sleeping, you get interrupted when you're eating, even sometimes when you're peeing, you kind of get beat down and become numb. And I remember signing up for a trip to Peru, remembering my trip to Bolivia had been so rejuvenating, and so had my trip to Guatemala. And so when I got there, I was working at a referral center. It's one of the big hospitals where the sickest of the sick go, and the strange cases that can't be solved by the local doctors go. So a lot of patients were scared to go there because they felt that it was basically a death sentence. And for many of them it was. For many of them it was a trip into a big city from their campo that, they were comfortable in, and doctors throwing new medications and new big words at them that they just didn't understand. I remember thinking that the system was overwhelmed there. The doctor that I was there was an infectious disease doctor, because that was some of my interests, but he was also in charge of the foreign visiting doctors. He was also part of the board for the committee of the hospital, and et cetera, et cetera, et cetera. He was being pulled in 10 different directions all at once, and his primary concern was supposed to be his patients, but I could tell it wasn't always. I remember hearing a lot of times the way these doctors had to address their patients in the interest of time is what they would say. They would talk to their patients for 2 minutes. They'd do a procedure under no anesthetic. I'd tell them, stop gagging, stop crying, you just have to suck it up. And then the patient would stop gagging, stop crying, and suck it up, and I just couldn't believe it. And I was like, usually we get sedation for that, Usually we get local anesthetic for that. That's just salvaje is the word that best came to mind. And I remember being so distraught and slowing down and asking one of the doctors, just why does it seem so divided? Why does it seem like there's so little time for your patients? And I remember them telling me that a lot of those patients just were not educated, that one of them actually went as far as saying that if they had to save their farm animals instead of their children, they would save their farm animals. And I just was like, is that really the image that you have of your own people? Obviously, they weren't educated in the patients that they were treating, even though they were the exact same background, the exact same culture, the exact same nation. They didn't know their patients, nor did they care to know about them. I realized that the lesson that I had to take from that was the kind of doctor that I don't ever want to be or ever want to have, or anybody in my family to ever have. And again, while I learned a lot from the experience, I can't say that every single doctor there would have been the same way, but I think I had enough. So coming back to my life, now I'm in California. I live near the border, and I see maybe 90% of my patients are Mexican. Probably 80% of them can't speak English. So yes, I get to talk to them, and yes, I get to understand them. And I had a patient on rounds a couple months ago probably, and he asked me, he had a really bad, gastric issue, having a lot of nausea, vomiting, and diarrhea, and we just couldn't fix him. And he asked me if it was okay if his wife brought him in some 7-Up with bicarbonato. I don't know if anybody's ever tried that as a kid. Yeah, I see that over there. And I was like, my mom used to do that to me. She used to do the empacho. Does anybody ever know what empacho? I had empacho, and I got my skin pulled when I was a kid. And I was like, yeah, have her bring it. And it was so therapeutic for him. I don't know that it really helped, or if it was the 3 weeks of antibiotics that finally eventually kicked in. But in his mind, it was his 7-Up and his bicarbonato. And I felt so part of him that I could relate and say, yes, I've had that, and yes, it's worked for me. And you know what? If you want manzanilla, get some manzanilla too. Again, those are things that only I, having lived through it, could go through. But people can learn from it. And the big thing is being open-minded, knowing that racial and ethnic composition of our population is important, and it does have consequences that affect not only us, but our nation as a whole. And disease prevalence is different wherever you go. The way people treat it is different wherever you go. The key thing to remember is that you can make the difference. You need to advocate, and you need to empower your community. You guys are in an amazing situation. Cristo Rey is going to make you successful. You guys are going to push for it, and you guys are going to be our future generation. One day you guys will be up here, not me. But you have to start now. You have to start in your community. Volunteer, get out there. I know when I was in college, I remember holding a patient's hand because he was there at the hospital alone. I had nothing medical to do then, but I was volunteering at the hospital because I knew it was good for my resume. And I remember bringing them blankets, and they were so grateful. Just little things like that make a difference, Little things that, again, you just have to be a little kinder than necessary, because everyone you meet, no matter where you are, is fighting some kind of a battle. Have compassion. Treat people the way you want to be treated. Respect, respect, respect. And remember, I ask myself every day, would I want my family member to be treated by that person the way he's being treated, the way he's treating others? And that usually kind of sums things up for the way you should be. There's so many barriers to overcome, but things move along. Again, I am first generation Mexican-American. I was probably one of the only ones in my graduating medical school, and I know that their numbers are getting better. We had one African-American that was in my class, and I think he stayed behind an extra year, but he got through it. They've got a lot more now, I know. I keep in touch. My residency class, I was the only Latina. There weren't even any other foreign Latinos in that class. The class under me now has 2. I'm one of 2 Latinas in my practice in a group that sees 90% Latinos. Only 2 of us of the 9 speak Spanish, but the other ones do try. So again, it's possible. You can find them out there. There are people that care. Basically, what I'm trying to tell you is that it's not always comfortable, but you have to push. You have to go out of your way, get out of your comfort zone, and make a difference. Make that difference for your family, for your kids, and for the people that are eventually going to come after. I may not be in East Chicago right now. We're working on that one. And I will tell you, God's overall plan is going to take me wherever it needs to take me. And I think that He's taught me a good lesson, that even though I'm not ni de aquí ni de allá, I'm sure a lot of you guys have heard that phrase before, I've found my spot in society, and I hope to be able to, with these last couple of words, inspire you to find your spot. I hope I didn't bore you too much, and thank you for your time and attention, especially on a Saturday, even though I guess it's not as nice as it was yesterday, so it's better to be in the warm. If you guys have any questions about resources or anywhere of the statistics that I kind of left out a lot, please come and talk to me. I have a massive list of Google searches that you can do and stuff. And if anybody has any questions now that I can take, I can help. If not, thanks.